Program is now raising the alarm over the seemingly high number of deaths occurring from the preventable and curable disease. Public health specialist Dr. Tuime Bawandu joins me in the studio now to talk about this, and much later on we will have our second guest joining us, an epidemiologist and member Association of Public Health Physicians of Nigeria, Dr. Oladakwa Ashinyobi, joining us much later. But let's begin with you, Dr. Tuime Bawandu. Good morning.
Good morning.
Thank you for joining us on TVC Breakfast. Now, when you look at the report, tuberculosis is a major public health problem in Nigeria. And from the report, Nigeria still ranks highest in Africa, and it's ranked 6th all over the world. And you wonder, we have been putting in so much effort, so much, in quote, to addressing this issue. But what really are we not getting right, such that we are not getting that result that we want to see?
Prior to the COVID experience, we were on track in terms of reducing the burden of tuberculosis and the death, both new infection and the death from tuberculosis. But the tragedy of COVID-19 then created a new paradigm, a new problem for the fight against tuberculosis. First and foremost, critical attention in terms of funds that are supposed to go to tuberculosis went to COVID, and then secondly, the information gathering system had to be diverted. Now, there's still a critical missing number of about 500,000 people that, that we're not 3 million people that we're not picking, and 500,000 people that are having multi-drug resistant tuberculosis. So for us, it's a combination of, one, the finance to actually fight TB, secondly, the human resources, and thirdly, the coming up of COVID-19. Of course, you know that Nigeria is high in the numbers of people with HIV, AIDS, and malnutrition. These are factors that actually, create a kind of triple whammy for fight against tuberculosis. So these are a combination of these are the combination of combining factors that actually, militated against the fight against tuberculosis.
You mentioned about 3 million people that are still missing. Are you talking about the aspect of knowledge gap that still do not understand what perhaps the symptoms or what tuberculosis is about, or how do you mean when you talk about them?
Because number one, you have to actually actively pick those people. Let's appreciate the fact that we have latent tuberculosis, people that are not actually manifesting the symptoms in the classical symptoms of tuberculosis. And then, of course, tuberculosis itself has a protein manifestation. What this means is that it can appear in a funny form that you may not suspect until probably a health worker then tries to look at the person. Now, we've seen efforts, even at the level of NGOs and private initiatives, to actually drive and get to understand and pick more tuberculosis, especially by partnering with private hospitals, partnering with NGOs, going to the community, partnering with pharmacy and co, to see, is anybody coughing? Let's pick the specimen and then check whether the person is having tuberculosis. Now, the 3 million gap came because a lot of these tuberculosis cases are not detected. Because it's not showing the classical symptoms as we expect, that maybe weight loss, night sweating, coughing. Okay, it's not showing classical like that. That's where the 3 million came from. And of course, we've seen different interventions at the level of SDG, Goal 3, Target 3, trying to say, okay, tuberculosis, TB, HIV, and malaria needs to be reduced. We've seen intervention at the level of WHO Stop TB, where they're saying that, okay, 90% of number of new cases must be reduced and 80% of prevention must be targeted at people. We've seen even intervention at the United Nations National Assembly, UN General Assembly, saying that we're committing 30 million to fight tuberculosis. We're committing another 40 million to do research on tuberculosis. But of course, with the coming of the pandemic, finances for people that are supposed to bring money has reduced. The last year funding was done essentially by BRIC countries, Brazil, Russia, India, China, and South Africa. But now, as much as 80% of those funding was done by them. But look at what the COVID has done to the whole world in terms of the finance. So this is causing a lot of challenge for the fight against tuberculosis, or except we now rethink and re-energize our attention to reducing burden of tuberculosis.
All right, let's bring in our second guest now, epidemiologist and member Association of Public Health Physicians of Nigeria, Dr. Oladapo Ashinyombi. Thank you for joining us on TVC Breakfast. Dr. Tui Mebawandu has been talking to us about the efforts we have put in so far and the challenges we have been facing towards achieving the desired result. Because we are just 2 years away from the national destination of 2025, saying that perhaps that will be the year when Nigeria will be able to, put an end to tuberculosis in Nigeria. But when you look at all of these challenges of funding, tracing, and all of it, how close do you think we are, or how far are we from achieving our 2025 goal?
Thank you very much. Well, we are far. 3 million is not a small number compared with where we are coming from. We've been at this for quite a while, and I'm sure we will not be able to achieve that 2025 goal. Now, the reason is that the general approach to managing conditions or disease has taken a parallel way of looking at things. What I mean by that is we're not integrating our effort into a system. If we had spent our time and effort on making the system itself strong, then every other disease or challenge we have will be tackled from a strong health system. Now, the health system has 3 layers. I mean, supposedly, that's the primary, the secondary, and the tertiary. Now, each of these systems has 6 components. You have health finance, where we are very far from our global target, even the African target of 15%. You have human resources, where on the average, the health worker to patient ratio is a range of between 1 to 3,000 to some places 10,000. And it is worse off in the periphery, that is the rural area, compared with the urban. And I'm not sure we have up to 30% of the human resource we need. To make matters work, we're having emigration of our health workers to better climes. The third thing is leadership and governance. Now, most times in picking leadership of those in the health system and the national system itself, it is usually not done based on target experience. It's usually done because of nepotism. Who knows who, man knows man. Now, our health information system, which should drive where we go, is fair, but we can do better. Most hospitals still run on paper-based, so it's difficult aggregating data on time and to take action immediately. Now, our technology, which is our hospitals, our primary health clinics, our general hospitals, and how we run them, most of them are not a state that people can be proud of. And so we need a lot of investment. So TB is just one. COVID has shown how weak our system is. Now, the goal to achieving universal health coverage, of which TB is just one of the need, is strengthening the bottom part of the rung. That is the primary healthcare system. If we strengthen that part, it gives access to over 80% of our population. And one of the components of primary healthcare is control of common epidemic and endemic disease. So TB is just one of them. Now, if we have that strong system that meets 80% of the needs of the people, and we most importantly ensure that the community participation from the bottom is strong, people will own their health system, people will run it and manage it, and people will ensure that their friends and family who they love have access, and then we can get to the promised land. Thank you.
All right, let's bring the conversation to the studio now. Dr. Tui, experts believe that if countries like Nigeria are to meet up WHO's targets, there will be the need for a safe and effective vaccine. But you know that there is a vaccine administered at infancy, but that has not really stopped people from, contracting tuberculosis at adulthood.
Yes, because again, if you look at even the immunization, what is our coverage? Even we're talking about this immunization, the best we've gotten is about 30–40% coverage for immunization, even for child immunization. You understand that because the amount of fund needed to deploy child immunization is much, and we have to rely on partners, Bill and Melinda Gates, the Gavi and Co., to bridge the gap in the funding. So now, like the other doctor mentioned, we have to actually get to that bottom line and ensure that we step up this thing. And then what is also complicated, because if you appreciate the vaccine, at the end of the day, what we're having is that we're having latent tuberculosis. Once we have the complex that is in the lungs, okay, and it's not being activated, low immunity will activate it. Malnutrition will push it up, okay? Then HIV will also make it worse. So if you're seeing all this, what's it called, the figure we're seeing, you can't separate it from the level of malnutrition and HIV/AIDS in Nigeria. So in a way, if we can then focus and not look at this in silo and say that, listen, we're dealing with TB and TB alone. If you can look at that, what are the other factors, other diseases that tend to promote and push TB numbers up? Okay, somebody with HIV/AIDS, someone with malnutrition, and then overcrowding, prison services, displacement. These are factors in tuberculosis numbers in Nigeria. So if you're looking at TB alone and not addressing those factors, yes, you don't even have the sufficient resources to pick out the tuberculosis, but those factors will keep pushing the number up. And of course, human resources for health is a huge issue. Finance is a huge issue. Even the malaria we're battling with, we don't have money.
Yeah.
So unless we can do some integration and not look at this in silo, we might again reach the goal we're targeting. As it is, those factors are pushing the number even in adults, because what you have is a latent tuberculosis which can be there if your immune system is good, if you eat very well, if you're free from HIV/AIDS, and if you're not staying in an overcrowded environment. So these are factors that we need to look at.
So it can be there, but then causing some damage.
No. Right. No, you see, if you understand the history of tuberculosis, somebody picks the germ as it is from the air, and then the body wall the germ somewhere inside the lung, mostly inside the lung. Majority of cases, but it can also affect any other part of the body. Now, the thing will remain quiet inside the lung until such and such condition reduces the immune system and then bring out this disease. Now, children are prone because they are still developing their immune system, and they may not be able to actually respond appropriately. Whenever you see a child with tuberculosis, look for an adult that gave the tuberculosis to the child. So, I mean, you have to actually be able to look at that triaging. So now, it stays there in the lungs until that condition that then make it to come up and manifest fully as tuberculosis, malnutrition, overcrowding, poor ventilation, HIV/AIDS. These are factors that then make a latent tuberculosis active.
All right. Dr. Oladapo, let me come back to you now. I don't know if you also see the issue of vaccines that experts are calling for if we are to meet up as being the solution.
Thank you. First, let me say that childhood immunization, which is one vaccine, BCG, for children, our coverage in Nigeria is about 60% as of 2019. So what we're saying is 6 out of 10 children who need BCG get it. So we're not really far behind. Now, when they leave that childhood stage, then they get to the adult stage, there are no vaccines. But that challenge is not just the vaccines. It would be nice if the world can develop an adult vaccine. I mean, it will reduce the expenditure on health, on the treatment, the detection, and all that. So it will be a good way forward to drive research and development into vaccines. However, when we look at what the real problem is, because even the vaccines themselves cannot be delivered outside a strong health system. I keep going back to the strong health system and the primary health care. Now, if you look at the finance for health generally, in Nigeria, 70 naira out of 100 naira that is spent in health is spent by people bringing money out of their pockets to pay for health service. Now, if you just transpose that with that 90 million Nigerians are in extreme poverty, it now tells you that even if they want to come and receive service where it's available, the indirect cost of bad road, cost of transportation, or lack of access, only by that will cut off some people. So what do we need to do? We need to provide a good funding mechanism that is smart and that can save people from falling into poverty. Some people have started TB treatment, but because they cannot continue their treatment for maybe after, because it takes like 6 months for them to get the full treatment, 4 to 6 months. So some people will do a month, then they don't come back. You have to trace them. The system is true. If we find a way that health can be cheap and we can share costs, meaning that those who are rich, we're able to do progressive taxation or do a health insurance scheme that is universal. Our national health insurance scheme, at best now, only covers 6% of our population. So something as small as 1,000 or 2,000 cost of health is challenging to people who earn less than 700 naira a day, which is like 30,000 the minimum wage. So we need to focus on strengthening the health system, fund the health system, let the community participate to govern the health system, and have a robust information system for review, research, and development. Thank you.
Right. All right. Dr. Tuyi, your final words on this, because earlier you spoke about if we need to step up, there are things that we need to do if we are to perhaps move closer towards our goal, towards 2025.
Again, the first thing actually is finance.
Right.
Okay, because, you know, if you want to actually push further, the contact tracing, the drugs and everything, you need finance. Even human resources, you need finance. The second thing is human resources. And then again, of course, obviously, clearly, even as demonstrated by the COVID, our health system needs to be strengthened. We need to actually go back to the primary health system. You know, of course, out of the numbers of about the number of primary health care systems we're having in the country, just barely 30% or 40% of them are functioning appropriately. So we need to go to that level and be able to have that political will. It's very important. The political will is important, okay, if honestly we need to deal with the target. And then more importantly, other contributing factors that is actually pushing up the TB numbers must also be looked into. It's very critical.
Now that we have seen that the COVID-19 pandemic has shown that countries are looking inwards to addressing these issues, you mentioned earlier that those monies that we receive externally is no longer coming forth as it used to be. When we're talking about funding, I want you to expatiate on that. How then should we begin to look at perhaps generating funds to addressing this issue?
Well, first and foremost, we need to rethink our national health insurance scheme in such, because where we are now is just barely less than 5% of Nigerians are covered by national health insurance scheme.
Yes, which he also mentioned.
The community level, of course, the funding system, the national health insurance funding system must also be able to cover the community level. There's community insurance that we can really leverage on and see how to, you know, raise funds. Then secondly, we made commitment at Abuja, you know, in 2000 to say that we're doing 15%. We have to up this thing, you know, because if you're doing 4%, 5% of your budget for health, that is peanuts. It's not going to achieve anything. We need to find a way to up it. We need to actually seek the cooperation of different companies, organizations within Nigeria that understood the fact that without proper health system, there won't be, you know, healthy human beings to run your company. And through the CSR, and say that, listen, what are you dropping, you know, for this, for primary health? What are you dropping? And then we should be able to give them incentive in that regard, so that at the end of the day, because if you don't move human resources, if you don't move seek fund from all these resources, all these resources, you won't be able to touch the health system as you want to.
All right. Thank you, gentlemen. Public health specialist, Dr. Tuyime Bawadu, as well as a epidemiologist and member Association of Public Health Physicians of Nigeria, Dr. Oladapo Ashunyobi, for your time on the